So this afternoon, what we will be looking at is mental health, largely with the drive and the aim to get us to a point wherein we're able to maintain positive mental health states. Because the truth about the matter is this: if we do not understand accurately what mental health is, then we will not be able to manage effectively our mental health states. And so it's important that we first of all set the ball rolling by helping us to understand what really is mental health and what are the nuances and the nitty-gritties that actually underscores the understanding of mental health. Now, many times when we have a conversation along the lines of mental health, one thing that always seems to pop up is that there is a limitation in the scope of its definition. Many times when we say mental health, we're usually quick to consider in our minds that mental health really is about a mental illness. It's about, whether an individual has had a mental health condition or not. But the very first thing I want to establish this evening with us is that mental health is much more than that. And that has to, first of all, register in our minds. That when we say mental health, we're not just referring to the absence or to the presence of a mental health condition or a mental health illness. What we're really saying when we say mental health is that it's a state of well-being in which an individual is able to do four things. A state of well-being in which an individual is able to do four things. And I want us to take those things to heart and have them actually register in our minds. Number one is that if I'm going to take my mental health seriously, the first thing I must consider is I must be able to realize my potential. Because the truth is that we differ from person to person. And so what I can handle differs from what you can handle. But the very first thing that we must be able to realize as individuals is that I must realize what exactly is my potential. What exactly can I take? How exactly can I walk? How exactly can I put up with certain things? And so being able to realize our potential is one of the first steps in the right direction when it comes to understanding mental health. Number two is being able to cope with stress. Now, interestingly, in this part of the world, we seem to find a way to just continue to live with the stresses that we face without taking conscious efforts to manage it effectively. And so we would find that there are individuals that are going through stressful situations, that it is beginning to affect their mental health, and they clearly aren't doing anything about those stressors that they are experiencing. And so the second part of that definition is being able to cope with stress quite effectively. Number three is being able to work productively and fruitfully. So the third thing is being able to work productively as well as fruitfully. So that means that when an individual is unable to become productive or to be actively engaged in what it is that they are doing, then their mental health already is beginning to take a bashing. And then lastly, we must also be able to make meaningful contributions to our immediate community. Meaning that if I'm really going to consider my mental health seriously, then I must begin to think beyond myself and actually think of the bigger picture. I must think of the organization that I'm working with. I must think of how I'm contributing to the immediate community that I'm a part of, and being able to engage that community in such a way that I'm also being selfless to some degree. And so when we say mental health, we're actually saying these four things put together: an individual realizing his or her potential, an individual being able to cope with stress, an individual working productively and fruitfully, and also being able to make meaningful contributions to their immediate community. And that's really how the World Health Organization also defines it. So we must begin to shape the conversation with that understanding that mental health is not just about the presence or the absence of an illness, but it's about an individual doing these four things that we have mentioned. Now, having looked at the definition of mental health, the other thing that is up for consideration is that we must also view mental health as a continuum, as a spectrum. That is, when it comes to mental health, it's not about yes or no. It's not about a high or a low. Really and truly, it's about us understanding that there is a spread to it. There is some sort of ladder, some sort of spectrum to mental health. That is to say that every single day, you and I are moving up and down this particular ladder, and we are able to view mental health as a continuum. That is to say that there are days wherein we feel like we're thriving, wherein we feel content, wherein we feel fulfilled, but yet there are some days wherein we don't feel that way. And so the interesting thing that we must begin to admit to ourselves is that we most likely will not have our best days every day. There will be some days wherein we feel a bit down, and so we must understand that we don't place ourselves under so much, scrutiny when we find ourselves in such situations. So we're all going to be moving up and down this ladder, and the first question we must ask ourselves is, what are the factors that are responsible for how I move on my mental health continuum? What are the factors that actually play a significant role, in dictating how I actually am able to, navigate on this particular continuum? And so there are about 3 of those factors when broadly categorized. And the very first one is an individual's genetic makeup. Now, when we discuss mental health, the interesting thing is that many times individuals are quick to make the assumption that it is primarily hereditary. But when we discuss it and we look at the genetic makeup, what we're really saying is that mental health is not entirely psychological, but it is also physiological. And I'm going to explain what I mean by what I just said. That is to say that when we say mental health, we're not just thinking and speaking about the mind, we're actually speaking about the entirety of the body. Because the truth is this, is that the way we feel is not entirely about what is happening around us, but it's also about what is happening within us. That is to say that there is what is called the brain chemistry composition that is responsible for our mood stabilization, meaning that there are chemicals that are within the body that actually help to coordinate and maintain our mental health. And so an individual genetic makeup plays a huge role in that particular brain chemistry composition. Also, the individual's upbringing, the level of grit, the level of development that they were able to experience as they were growing up, also plays a huge role. Now, the next thing to view is the life circumstances that we go through. Now, it's important to know that the life events that we experience would actually shape our mental health as well. Now, the very first thing that we usually would consider here are the negative life circumstances that individuals go through, perhaps the loss of a loved one and the need to grieve that particular loss. But I often try to mention at this point that we shouldn't get carried away completely by just viewing negative life events. We must also understand that positive life events also shape our mental health. And I'll give you a classic example. A woman can put to bed, which is naturally a thing of joy. It's a positive life event. But that life event can cascade downwards into something called postpartum depression. So yes, it's a positive life event, but yet it can actually affect the individual's mental health as well. And so that can happen, and we must have that understanding. On a slightly lighter note, I often also try to say that, an individual might be earning 100,000 naira a month. And all of a sudden, if their income is catapulted from 100,000 naira monthly to 1 million naira monthly, it can actually affect their mental health. Now, I know that there are quite a number of people in the room that are saying that try me, that let the HR just try me and increase my salary from 100,000 to 1 million and see if it will affect my mental health. Now, the most important point I want us to take away is that it's not only negative life circumstances, but also positive life circumstances can also affect an individual's mental health. And then the third category are the stresses that we go through on a daily basis. An interesting thing to note here is that it's not only external stressors that we have, there are also internal stressors that we might be struggling with, such as anxiety, uncertainty, fears, phobias, and a number of other things like that also constitute internal stressors. And so we must be able to manage the stress that we go through quite effectively. I'm going to try to speak to that subsequently. Now, one of the things that saddens my heart is that many times when we discuss mental health, we hear instances and stories of individuals that all of a sudden, begin to attempt or begin to consider committing suicide. But one thing I like to always point out is this, is that when we see such cases, it did not start from there. There are warning signs that must have been prevalent that we probably did not pay attention to. And I just want to quickly walk us through some of those warning signs so that we're able to, first of all, look after ourselves, meaning that we must pay attention to ourselves. And then secondly, we must also be able to look out for one another so that when we find these warning signs playing out, we're able to actually step in and do the needful. So number one on that list of warning signs is when we find individuals who seem to be pulling away from other people or from previously pleasurable activities. So when we find individuals pulling away from other people or previously pleasurable activities, it is a warning sign. So you find someone who all of a sudden will just rather recuse themselves, will just rather stay in isolation and not want to have meaningful and engaging conversations. That is a warning sign. And let me just quickly say here so that it does not become misleading. A warning sign does not necessarily mean that the individual has come down with a mental health illness. There might be logical reasons why the individual is going through that particular phase. There might be reasons why that is happening. And so we must bear that in mind and not be quick to diagnose an individual because we see any of this warning signs. So number one, an individual pulling away from other people or from previously pleasurable activities, things they used to like to do before, all of a sudden they want nothing to do with those activities. It really is a warning sign. Also, sometimes you find that an individual's eating habit or sleeping habit has been impacted, so much so that they begin to eat too much or too little, or begin to sleep too much or too little. It is a warning sign, and it's something that we need to step in order to have a conversation about those particular things that the individual might be going through in that particular instance. So that can happen. Also, individuals can have unexplained aches or pains, meaning that they tend to have what is called a psychosomatic disorder, meaning that, the reason why they are feeling those aches and pains is not anything physical, it's entirely psychological. So that can happen. After all medical investigations have been done, we don't find anything as the reason why the individual is going through that particular pain. So it's referred to as a psychosomatic disorder. Also, some individuals tend to feel helpless or hopeless. Now, when I often bring up this point, sometimes individuals casually say that if that's the case, that every Nigerian, feels helpless or feels hopeless. But that's not really what we mean when we say individuals feeling helpless or hopeless. What we mean by that is that the individual is unwilling to actually take steps to address their ongoing challenge. So you find an individual who is struggling with something and they just don't want to do anything about it. They've just left it and would rather languish in all of that struggle and all of that sorrow. Then the individual is said to feel helpless or hopeless. Also, individuals having a persistent negative thoughts, not just occasional, but persistent negative thoughts, something that they just can't get out of their minds, and it's just there, growing and continuing on a daily basis. That is really a warning sign that as an individual, if I identify that, then I need to speak up and talk to somebody about what exactly it is that I am struggling with. Now, the meat of this meeting, that is the meat of the matter itself, which is the burning question that should be in our minds, is what can I do in the midst of everything that is happening to maintain a positive mental health state? Because there is so much happening, both globally and locally. We're still battling with the tail end phases of the ongoing pandemic. And so there is just so much that is happening in these times that we're in. And so a very valid question that we must ask ourselves is, how can I maintain a positive mental health state in the middle of all that is happening? And the first thing I always like to say is this: we must normalize the conversation. We must be able to talk about our mental health without stigmatization. As much as possible, we must be comfortable enough to actually talk about things like this. Because the truth is that a number of people shy away from conversations like this. And that's why I found it impressive and quite exciting that we were open to having this conversation. It's such a laudable initiative that we opted to have this discussion. And so the first thing we must do, if we're really going to maintain a positive mental health, is that we must normalize the conversation. It's okay to talk about it. As a matter of fact, if as an individual we feel anxious, we feel worried, we feel uncertain, we feel troubled about all that is happening, we should not look down on ourselves. We shouldn't view ourselves as weaker or as lesser of human beings because we feel some type of way. It's a normal human response. It doesn't make us less of who we are. So we must be able to normalize the conversation, be able to talk about it, and actually have a honest conversation with a friend, with a colleague, with a family friend or a family member, and actually talk about what it is that we might be struggling with. The sooner we're able to normalize the conversation, the better it is for every single one of us. So number one is that we must be able to normalize the conversation and understand that it's a normal human response if we feel some type of way about all that is happening. Number two is that we must take very good care of ourselves. Remember that we mentioned earlier that mental health is not entirely psychological, but it's also physiological, meaning that how I take care of my body in its totality is actually going to affect my mental health. So number one, I must ensure that I'm eating healthy, prioritizing the consumption of fruits and vegetables. I must also ensure that I'm engaging in physical activity by means of exercising. And you might want to quickly ask in your mind, what does exercise have to do with my mental health? Now, some of those chemicals that are released that helps to maintain a positive mental health state are released when we exercise. So we must commit to at least 150 minutes of exercise on a weekly basis. Now, if we break that down, that's about 30 minutes of exercise in 5 days out of 7 days. So that's something that we should strive to achieve. We must also try as much as possible to get adequate and regular sleep. Now, let me just quickly say here that the conversation around sleep has moved beyond adequacy alone. Because many times when we discuss sleep and sleeping healthy, we usually just leave the conversation around getting 6 to 8 hours of sleep. But that's not all that there is. We must also get regularity. That the same way in which a child has a bedtime, as adults, we also should have a bedtime. We should have when we go to bed and when we wake up in the morning. We should have that so that the body knows that there is a pattern here, there is a rhythm here that actually helps to coordinate my sleep so that I can get the best out of my sleep. So it's important that we take very good care of ourselves. The third thing really quickly is that we should ensure that we don't self-diagnose. Unfortunately, in this part of the world, it's as though every single person knows what to take when anything happens. For some of us, we even have a drug cabinet or a drug basket in our homes. We already know what drug to take when what happens. And so one of the things we must ensure that we try as much as possible to do is not to self-diagnose. So if as an individual we have symptoms, for example, that bear a similitude with the ongoing pandemic, please and please and please, let's make sure that we actually have a conversation with a doctor. Now, one of the things that we have done at our end at Total Health Trust is to set up something called the Doctors on Duty platform. With a platform as easy as WhatsApp, we can have a conversation with a doctor. You can chat up and then just discuss what your concerns are, ask what your questions are, so that they get the requisite attention and the clarification that is important. So please, let's ensure that we do not just make up our minds and decide what we want to treat or what drug we want to take, but let's make sure that we have a conversation with a doctor so that we get the direction that we actually need. Now, the other thing we must also bear in mind is the need for us to develop a daily routine. It is not outdated to have a to-do list. It is important that we're able to coordinate all that we need to do. So we must develop a daily routine because it helps us to focus on the things that we can actually control. And it also helps us to increase our productivity. Remember that we mentioned when we're defining mental health that the individual has to be able to work productively. And one of the best ways to work productively is actually to have a daily routine, is to have a to-do list. These are the things that I want to achieve and to review those things at the end of the day. Now, I know that there are some days wherein life happens. You already have a plan and something entirely different comes your way. The most important thing is that if we're able to develop the habits, it will help us a long deal. Now, we must also bear in mind that as it comes to the children, whenever they have concerns, questions about the ongoing pandemic, we must be able to address those questions quite clearly and provide as much as possible simple answers that they would understand, as the events unfold. Now, the last thing I want to mention this evening is that whilst we are practicing social distancing, we should not devolve into practicing social isolation. And the reason is simple, is that the strength of our mental health state is tied to the strength of our social support structure, meaning that as individuals, our mental health really will thrive if we have a strong social support structure, meaning that we must leverage on the relationships that we have with our friends, with family, with colleagues. That relationship helps us in creating an environment that allows for us to have meaningful engagement and conversations. And that is something that our mental health really, really thrives on. And so we must ensure that whilst we're practicing social distancing, we don't devolve into practicing social isolation, so that at the end of the day, we're able to speak. Because unfortunately, in this part of the world, what we don't do enough of is talk about what we are going through. So we must, as much as possible, be open to having those conversations, and it will go a long way in actually helping us. Thank you very much, everyone, for listening.